Next on Primary Care, racism, a serious public health threat that directly affects the well-being of millions of Americans. Hello and welcome to Primary Care, the show dedicated to improving the health of African Americans. I'm your host, Dr. Lonnie Joe. In 2020, here in Michigan, Governor Gretchen Whitmer signed an executive order declaring racism a public health crisis. By signing that order, she joined numerous local and state leaders across the country who have also formally declared racism a public health crisis and threat. These declarations are a great start. But if we are to eliminate the systemic racism Black Americans have experienced for generations, it's not enough to simply label an injustice. We must take the necessary steps to replace injustice with justice. My guest today is Dr. Camara Jones. Dr. Jones is a family physician and epidemiologist whose work focuses on the impact racism has had on the health and well-being of the nation. She has taught at the Harvard School of Public Health, the Morehouse School of Medicine, and the Rawlings School of Public Health. She also served as a medical officer at the Center for Disease Control and Prevention. She is a past president of the American Public Health Association, where during her tenure, she launched a national campaign against racism, where she identified racism as the root cause of race-associated differences in health outcomes. Yes, she is not afraid to say the R word. Dr. Jones, it is such an honor to have you on the show today. Today's show is part of a two-part series on race and health. You have a very interesting story to tell about how you experienced and came into the understanding of racism. I think it will be a good starting point for our conversation today for our viewers to dive right into this discussion. Will you share that story?
Yes, well, thank you. Before I even share this story, it's one of my many allegories or teaching stories on race and racism. I want to say that there are 4 key messages that if people don't get anything else from our conversation today, 4 key messages that we need to understand about racism. The first being that racism exists. The second being that racism is a system. The third is that racism saps the strength of the whole society through the waste of human resources. And the fourth is that we can act to dismantle racism. So the story that you're referring to, which I call Dual Reality, a restaurant saga, is going to help people understand that first key message, that racism exists. And it was, like most of my allegories, based on something I saw with my own real eyes. So the story takes place on a Saturday when I was a first-year medical student. And of course, I was very diligent, very studious. So on this Saturday, like most, I had awakened early and I had hit the books and hit them hard. And it was already afternoon when I looked up and some friends had come over. Now, did my friends distract me from my studies? Oh no, we all got to studying long and hard. And now as it's getting late, we're getting hungry and I have no food in the apartment, which was so typical of me that my friend said, "Never mind, Camara."
Most medical students, no food in the fridge.
Like most medical students, right? So they said, like, "Never mind, Camara, we got you, we understand, but we are hungry. So let's go into town and find something to eat." So that's what we do. So we walk into town and we find a restaurant and we walk in and we sit down and the menus are presented and we order our food and the food is served. And here we are eating. So that's not the story that you might have thought I was going to say about restaurant and racism. But hold on. As we sat there eating, I looked across the room and I noticed a sign that was a startling revelation to me about racism. So now you're curious and you're like, okay, Dr. Jones, what did the sign say? Well, what does the sign say? The sign said, "Open." Maybe I've lost some of you now. So let me recap. Here we are, sitting at a restaurant, eating. I look across the room, I see a sign that says "Open," thinking no more about it. I or any one of us might assume that other hungry people could walk in, sit down, order their food and eat. But because I knew something about the two-sided nature of those signs, I recognized that indeed now the restaurant was closed due to the hour, but firmly closed. And that other hungry people, just a few feet away from me, but on the other side of that sign, would not be able to come in, sit down, order their food and eat. And that's when I recognized it wasn't just the sign in this restaurant, that racism structures open, closed signs in our society. That racism structures, if you will, a dual reality. And for those who are sitting inside the restaurant at the table of opportunity, eating, and they look up and they see a sign that says open, they don't even recognize there's a two-sided sign going on, because it is difficult for any of us to recognize a system of inequity that privileges us. So, for example, it's difficult for men to recognize male privilege and sexism. Difficult for white Americans to recognize white privilege and racism. Difficult for all Americans to recognize our American privilege in the global context, except that we're really living that out loud right now with how much of the global vaccine supply against COVID we have sort of sequestered in this country. But those on the outside, they're very well aware that there's a two-sided sign going on, because it proclaims closed to them, but they can look through the window and see people inside eating. So back inside the restaurant, and let me wrap it up, and then I'd love to talk to you about some of the nuances of this story, but let me just wrap up the essence of the story. Back inside the restaurant, to those who ask, is there really a two-sided sign? Does racism really exist? I say, I know it's hard for you to know when you only see open. In fact, that's part of your privilege, not to have to know. But once you do know, you can choose to act. So it's not a scary thing to name racism. It's actually an empowering thing to name racism. Doesn't even compel you to act, but it does equip you to act, so that if you care about those on the other side of the sign, which is an if, but if you do, why, you could even talk to the restaurant owner, who is, after all, inside with you. And you could say, restaurant owner, there are hungry people outside. Why don't you open the door, let them come in? You'll make more money. And oh, the conversations we could have. Or maybe what you'll do is pass some food through the window. Or maybe you'll try to tear down that sign or break through the door. But at least what you won't be doing is sitting back saying, wonder why those people don't just come on in and sit down and eat. Because you'll understand something about the two-sided nature of that sign. So if I have 5 or 6 minutes to convey to people that racism exists and give them an image that I hope they will not forget, this is the story that I tell. I would love to talk to you just a few minutes about like embellishments to this story, but I also charge all of our listeners to try to remember this story and share it with somebody who isn't listening with you right now.
Please continue. I think it's headed totally in the right direction. Go right ahead.
Okay, so the first thing I need to say is that I actually started a 3-hour conversation in Flint, Michigan a few years ago, when I asked a group, after telling this little 5-6 minute story, I asked them, how could people who were born inside the restaurant know something about the two-sided nature of that sign? And it was a 3-hour conversation, because there are many, many ways to know. First of all is to wonder, why aren't people coming in? Or to maybe go on the other side of town, go on the other side of the door and see the reality. Or wonder, how does the food get in here? I mean, just wonder. Don't be so complacent with, I'm so happy to be in here eating, that
they're only seeing one side of the sign. They're only seeing one side of the sign.
Only seeing one side of the sign and thinking that their experience is universal. We are all in bubbles of experience, and most of us, no matter if we have big bubbles, small bubbles, tinted bubbles, polarized bubbles, whatever kind of bubble we're in, most often we do not know that just across town there are other people who are just as kind, funny, generous, hardworking, smart as we are, who are living in very different circumstances. What we need to do as individuals and as organizations and as a society is create bubble bursting opportunities, so that we can experience the common humanity in different circumstances that's just across the river, or just across Woodward, or just across just across town. And once we experience that common humanity in different circumstances, we're more likely to start building common cause. But that's just one thing. I want to say one more thing and then ask you, engage in some more conversation. I am heartened I would say, that more people who were born inside the restaurant have been recognizing there's something two-sided about this sign. I would say since COVID started uncovering the structural racism in our society in terms of health stuff, and since the murder of Mr. George Floyd and so many before and so many after him, and we've had the mobilizations and more people from across many different communities have mobilized and recognized that there's a two-sided sign going on a little bit. But let me warn us, if we just say a thing like the amazing statement by Governor Whitmer, that is amazing. She joins what are now, the last time I looked, which was about 3 weeks ago, there were 208, I think, statements from city councils, county commissions, governors, state legislators across 37 states declaring racism to be a public health crisis. That's a great thing. So Michigan has done that, right? Maybe companies have put something on their websites, right, about anti-racism, this, that, or the other. Maybe people have tweeted something on. But if we just say a thing, as important as it is to name racism, that is the first step, that is crucial. We must name racism, because if you don't name a problem, you'll never get started to trying to solve it, right? But if we just name racism, racism denial in this nation is so widespread and so seductive that if we just say a thing, 6 months from now, we may forget why we said that thing and fall back into what I describe as the sleepiness or the somnolence of racism denial. So we have to go beyond saying a thing, beyond naming racism, to action. We need to tear down the sign. And of course, racism is not just the sign. It's the door, it's the lock. There's a whole system going on. We need to dismantle the lock, take the door off the hinges, because once we start acting, we will not forget why we are acting.
Well, you know, getting past this barrier of denial is something that we experience in all levels of interaction with, especially with patients. I find, Camara, that if a person or a patient is in denial, I can't help them. After a point, I can't help them. If they're devoid of facts, I can help them. This becomes a teachable moment both ways for us. But this denial issue is very difficult to overcome. So denial in your example is looking at the sign on that door and seeing open from your perspective, thinking that it's open for everybody. And in actuality, the facts say it is not. What can we do to help this country get past that denial?
Well, denial is that, what you said. Denial is also when people show you that it's two-sided, still say nope,
Still say no.
Not two-sided. Because we have so much evidence of the impacts of racism on education and on income and on wealth and on health and on everything. But people come up with all other kinds of explanations for those differences that we see by race and say, no, it's not racism. So actually, I'm glad you asked me that question, because I have identified 7 what I used to call societal factors or cultural factors that are barriers to achieving health equity, which I have since reframed in my mind as the 7 values targets for anti-racism action, which I have also reframed as the 7 social delusions that undergird the intergenerational transmission of racism denial. And actually 4 of them are so clearly linked to racism denial. I'll tell you those 4 first, and then the other 3 are, even once we recognize racism, interfere with our basically caring about other people or moving to action, okay? So the first of the 7 is our narrow focus on the individual that makes systems and structures invisible or seemingly irrelevant. That narrow focus on the individual does other things too. But then if you're talking about racism, and racism is a system, people are like, system, what system? There's no system. What systems don't have anything to do anything, because they're very narrowly focused on the individual, even in terms of their idea of self-interest and whether they're related, you know, interdependence and all of that. The second of the 7 is our ahistorical stance. In this country, we act as if the present were disconnected from the past, and as if the current distribution of advantage and disadvantage were just a happenstance. And even now, a lot of these efforts to, you know, we can't teach history or full histories in our schools, you know, and all of this, framed as anti-critical race theory. People don't even know what critical race theory is. But all of this stuff that says you can't teach history, you can't talk about racism, you can't be talking about equity, you can't talk about any of that because it might make people uncomfortable, right? But that's a reflection of our ahistorical stance. The third of these four that are clearly related to racism denial is our endorsement of the myth of meritocracy. The story that goes something like this: if you work hard, you will make it.
Right.
Now,
Yes.
right? I give you that most people who have made it have worked hard, although we have clearly seen that not everybody who's made it has worked hard.
Exactly.
But most people who have made it have worked hard, but there are many, many other people working just as hard or harder who will never make it because of an uneven playing field which has been created and is being perpetuated by racism, as well as sexism, heterosexism, all of these systems of structured inequity. When we deny that uneven playing field, we actually blame people who haven't made it for being lazy or stupid. But the fourth is white supremacist ideology. Now, people are going to hear me and they're going to be, ooh, Dr. Joe, who do you have on your show now? But white supremacist ideology, which I lift up not as a lightning rod term to get a reaction from people, it is, when I say those words, it's the description of a false idea of a hierarchy of human valuation by race. There is no such hierarchy. But the even falser notion that not only is there a hierarchy, but that would put white people at the top as the ideal or the norm. This false idea, this white supremacist ideology, however, has many impacts. It's foundational. It's a foundational value, if you will, in our nation. When I describe racism as a system of structuring opportunity and assigning value, which is how I describe it, I can carry on with the definition later. But that is the white supremacist ideology, is the value thing. It results in many people who are living as white having a sense of entitlement. It results in the devaluation and dehumanization of people of color, and fear at the browning of America, which is underlying a lot of our political divide today.
So that fear drives us to think that we can rewrite the history that we teach to our public school students and get an outcome that's better?
The fear makes us not want to reckon with our past. It wants us, right, it wants us not to make things better, but to make things more comfortable.
Comfortable.
To make things more comfortable for the parents and the kids. Actually, some people who are talking about this anti-CRT stuff are actually saying they don't want their kids to feel uncomfortable about their history or their role in the world or anything like that. They've said that word comfort. So let me define racism and talk about how comfort comes in here, okay, or lack thereof. When I say the word race, I'm just going to give you a one-sentence definition, and then I'm going to lift up a few things, but especially on this comfort. Racism is a system of structuring opportunity and assigning value based on the social interpretation of how one looks, which is what we call race, that unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole society through the waste of human resources. So I wanted to share that definition. There are many important parts to it, but when you get to the comfort, I have actually experienced, because I talk about these three impacts of racism, the unfair disadvantage, but every unfair disadvantage has its reciprocal unfair advantage, right? But it used to be that if I were in a live audience, I would see people start to shift when I start talking about unfair advantage and, you know, acknowledging unearned white privilege. And I used to almost apologize. I used to say, well, if you feel uncomfortable, I want you to just shake it off. Stay with me because I'm going to tell you more stories. But I don't apologize anymore. I say that if you feel uncomfortable, what you need to do is lean into that discomfort, because for all of us, the edge of our comfort is our growing edge. But then the third impact, so the unfair disadvantage, the reciprocal unfair advantage, the third impact is that racism is sapping the strength of the whole society through the waste of human resources, and many people are not even recognizing that waste.
So basically, Dr. Jones, this can boil down to the individual's experience, how that individual experience gets broadened, that circle gets wider in terms of the people that they're associated with, the people in their family, their school experience. To take these basics that you have just pointed out, though, seems to be the roadmap of us winding up having a good understanding not only what racism is, but what life is about to some degree, and how we actually communicate and interact with each other, especially if we're ever going to address these issues associated with racism. That brings me to healthcare. It's got to have an impact on the health of individuals, communities, the country. Expound on where you see this being an infectious disease.
So it's infectious and it's chronic. It's all of that.
Yes.
So I would say that racism is the only reason that we see race-associated differences in health outcomes. Because the variable that we call race, that if you ask a group of people, like, what is race measuring? Some people might say, well, it's measuring social class. But first of all, and race is unfortunately in this country related to social class, but not because black folks don't work hard or, whatever. I mean, it's because of structural racism. It's because of historical injustices that are then perpetuated by present-day contemporary structural factors that are part and parcel of structural racism. So it doesn't just so happen that people of color in this country are overrepresented in poverty while white people in this country are overrepresented in wealth. That's not just a happenstance. So even as it's true that, say, black people are overrepresented in poverty, not every black person is poor. The plurality of poor people in this country are actually white. So there's not a one-to-one correspondence between so-called race and social class. So then what else is this variable race measuring? Well, people say, well, maybe it's measuring culture. Well, actually, within any so-called racial group, there are many, many different cultural groups. So even, within black, there are people who, are of African-American generations in this country who are in the urban south or urban north or the rural south, but there are also people who just immigrated from Ethiopia, or people just immigrated from Haiti, or people who just immigrated from lots of different places, people who just immigrated from Australia, right? Right? Who are called black because what race is the social interpretation of how one looks in this race-conscious society. There's no one black culture. There's no one Hispanic or Latino culture. There's no one white culture. There's no one Asian culture, right? So if race is a rough proxy, I would say, a rough measure of social class, it's rougher for culture. Now, people say, well, what about genes? What about genes? Well, we have mapped the human genome. There is no basis in the human genome for racial subspeciation. So then people say, well, why is race such a good predictor of health outcomes if it's just a rough proxy for social class, rougher for culture, meaningless for genes? And it's because race measures the social interpretation of how one looks in our race-conscious society. And that the way I look is the substrate on which racism operates day to day and historically. Racism, this system of structuring opportunity and assigning value. So the race that's assigned to me determines whether, if I'm running down the street, if I'm black, I'm seen as running from. If I'm white, I'm seen as running toward, right? It determines my safety. It determines the benefit of the doubt. It determines how much intelligence I'm accorded, or motives, and all of these things, as well as determining, in most part of this country, in what kinds of communities you're living, and exactly what things. And then when we have the residential segregation, which is part of the structural racism, that in and of itself is not a problem. I'm happy to live around other people who, have some of my same cultural backgrounds, right, or say historical. I'm happy to do that. But the residential segregation makes then the act of disinvestment of communities by race much easier. I had told you 4 of my 7 barriers. I had talked about the narrow focus on the individual, the ahistorical stance, the myth of meritocracy, and the white supremacist ideology. But the other 3 are, first of all, the myth of a zero-sum game, that if you gain, I lose, which sets us up in competition with one another. It makes us not recognize the cost of inequity, that it is sapping the strength of the whole society, through the waste of human resources, and it hinders our efforts to grow the pie. It's like I'm sitting at a potluck dinner. I see you coming. I don't want you anywhere near this table because I think you're just going to come eat up all the food. I don't even see all of the cakes and pies and roasts and salads and fruit that you are bringing. My view of you is so devalues that it invisibilizes all that you are bringing. The sixth of the seven is that in this country we have a very limited future orientation. Now, the parts of the future that each of us can touch today that will hopefully survive us are the children and the planet. In this country, we have a disregard for the children and a usurious relationship with the planet. We do not in this country have the same kind of idea about, many American Indian nations think about 7 generations from now when they're making decisions, make 100-year plans when they're thinking about policies. We don't think like that. And the Maasai people in East Africa, when they greet one another, they don't say, hey, how you doing? They ask, how are the children? And they hope to hear back from you, all the children are well. We don't even ask how are the children in this country. And even if we did, we wouldn't get the answer, all the children are well. We don't even think about all the children. We think about my children versus your children without recognizing that all children are our children. The seventh of these 7 is the myth of American exceptionalism. That here in this U.S., we are so special. So we're talking about U.S. exceptionalism, but we call it American exceptionalism. We don't even give Canada or Mexico or all of Central or South America the due that they are also American, right? They're part of American. But anyway, this myth of U.S. exceptionalism, that we're so special, so different, so ordained by God, that of course we should have special privileges. Of course, there's nothing we could learn from other nations. That's what's making us comfortable with having so much of this COVID vaccine and trying to cajole people into taking the vaccine when there are countries that haven't even seen their first shot yet. Anyway, so I forget how I got to that. So you have to rein me back in with whatever question helped me get there.
Well, just the other day, the Commonwealth Fund, out of 11 industrialized nations, ranked our beloved country number 11 in terms of how well we do in healthcare. This should really shock some people, especially when we look at what we spend on healthcare in this country on a comparative basis with other folks who have to do the same thing, treat the same heart failure, treat the same diabetes, et cetera, so on. Dr. Jones, for part 1 of this discussion, we are out of time. We can go on and on. We will pick this up on the other side of the break and go to part 2. Thank you for being our special guest today. Our guest has been public health specialist and family physician and native Detroiter, Dr. Camara Jones. Please join us next week for part 2 of this powerful discussion. For Primary Care, I'm Dr. Lonnie Joe.